Okay, now I will share my presentation on neonatal hearing screening program, specifically to the program that we run in Hospital Pakar Sultanah Fatimah Muar. I believe most of you already know about the program because it's already being implemented in Malaysia for more than 10 years. But today I will share a few updates regarding the program, as well as maybe refreshing information about neonatal hearing screening. So I hope all of you can stay with me to the end. Okay, first, why is implementation of newborn hearing screening is quite accelerating at the moment? Firstly, I could say because of the accepted by policymakers around the globe. Most of the country in the world has run the program, which is mostly the first country. They have shown a good and better result. Also a strong evidence in terms of managing patients with hearing impairment. This has given chance for others to replicate the program and follow it. So same goes to our MOH as the biggest policymaker in health industry for Malaysia. Next, I could also say because of the improvement on screening techniques and equipment, I could not deny, or we could not deny, that the tremendous development of current technology has contributed a lot on this. At present, we are using only a small and very handy device for conducting hearing screening. We also could get the result much more faster. Within a few seconds or a few minutes, the result will appear. And with no doubt regarding the better specificity and sensitivity of the result. Next, the increasing number of successful program itself. For now, we are looking more and more hospital has announced their successful program of this newborn hearing screening, either the local hospital or from other region. And the last but not least, the reason that I could list is increasing public awareness or public demand. The program itself has become a gossip in the air for quite some time, from one to another. This popularity has increased. So when the popularity has increased, it's mean the higher demand from the public. So we could not deny on that. So I hope this explanation gives you an idea how the program become more and more popular at the moment. Right now, why is early identification of hearing loss is so important? Based on much more earlier research, hearing loss is actually the most common birth defect. From WHO in 2009 also reported around 0.5 to 5 for every 1,000 birth could have a congenital hearing loss. This number is actually quite alarming because this figure does not include the one that might come later, especially that could be detected from the high risk categories of babies. Furthermore, regardless the degree of losses, the undetected hearing loss could develop serious negative impact. But there are also evidence if the child could be detected in earlier age of life, they might have a better outcome in terms of development, especially as the result of early intervention. Alright, here I have listed a few conclusions that I have concluded from a few famous researchers regarding the impact of hearing loss to children. So they say that the critical period for language and speech development generally will happen in the first 3 years of life. So the children who are identified who are detected with hearing loss in early age, especially less than 6 months, and receive immediate intervention could have better result in terms of cognitive, language, and social development. Furthermore, early detection and intervention as well could reduce the impact of hearing loss on children's development and educational achievement. Why we choose to do hearing screening at neonatal? This is actually based on research and others' experience from earlier program. They found that without a proper hearing screening program, children will always be referred late to us, which sometimes they might have skipped the critical periods for speech and language development. So, the neonatal period is actually chosen to avoid undetected deaf newborn as well as other high-risk category groups of baby until it's too late. As we know, the delayed detection will lead to poor rehab outcome. Another thing, if we are able to detect hearing loss at a very early of age, this means we could initiate the intervention program to the soonest because there are always limits to rehabilitation outcome, especially in regards to the timing of intervention. So, we could say the neonatal hearing screening program is actually the best mean to minimize the adverse effect of hearing loss. Early hearing detection and identification, or EHDI, is actually a terminology that has been introduced by Joint Committee of Infant Hearing in regards to the early detection program. Here they are actually gathering information from research finding, experience from the expertise, as well as gathering information about the best method of procedure to be a standard of practice in process for detection of hearing loss among children. So, they has made a clear statement at the end, which is to assure that all infants are identified as early as possible. And of course, the appropriate intervention should be initiated no later than 6 months of their age. So, following to that goal, neonatal hearing screening program has been initiated around the world. Now, a brief overview about neonatal hearing screening in Malaysia. We started this way back in 2001, where the NHS has been introduced in Ministry of Health Hospital. Initially, it was done only to the targeted high-risk neonate groups and known as high-risk neonatal hearing screening program. But after years, the group of baby to be screened has become bigger. This is in relation of certain hospital that has been upgraded in terms of their facilities. So for those hospitals, they manage to practice uh, hearing screening to all baby, or I can say to all newborn. So this program has known as Universal Newborn Hearing Screening. Um, but for your information today, these two programs now only known as one name, which is Neonatal Hearing Screening Program. Okay, our objective on neonatal hearing screening program is currently following the Joint Committee of Infant Hearing Statement, which is all newborns shall be undergone hearing screening as early as possible. They also have listed a few targets to be reached, which is number one is to screen babies by their first month of age. Number two is to diagnose any hearing loss by their 3 months of age. Number three is to provide intervention no later by 6 months of age. Last but not least is to facilitate early cochlear implantation in children. Currently, all KKM hospital with audio facility is running the program following the listed objective. Okay, this is a book of guideline for neonatal hearing screening. This guideline actually has been published by our KKM in 2015. So if any of you who need further information about the neonatal hearing screening, you may find the guideline in the KKM website. Okay, before we move further, I hope my earlier explanation has given all of you a clear idea about why we need to do early hearing detection and identification. Um, I also hope that it has given you a better perspective about why we need to implement neonatal hearing screening. Because after this, I will share the experience implementing a neonatal hearing screening program at Hpsf MUA. So stay tuned with me. Okay, now it's about our neonatal hearing screening program at Hpsf MUA. We started the program in 2014 only to babies with high risk criteria. But later in 2019, after we received a new asset, we decided to upgrade the program and becoming universal newborn hearing screening. So for now, we screen all newborn and all NICU graduates. All newborns were screened before they are discharged in postnatal wards on weekdays, while all NICU graduates are screened as outpatient in our audiology clinic no longer than 6 weeks after their discharge. The test is conducted by audiologists because we are still in the process of training the screening personnel among the in-house staff. So far, we are using the two-stage protocol, which is OAE as the first screening, followed by the AABR on the second screening. We have our own committee for this neonatal hearing screening program. Along with us, the audiologists, the main committee members include our hospital director, our specialists from ORL department, from pediatric department, from ONG department, as well as our matron, which representing our nursing division. The committee itself has been formed officially in mid-2019, which is exactly before we run the trial for universal neonatal hearing screening. Okay, these are the equipment that we use for the neonatal hearing screening program. As what I have mentioned earlier, we are using the two-stage protocol for our neonatal hearing screening program here. So that means we will use two different equipment for every stages. The first one is the automated auditory brainstem response, or AABR. It is actually testing the peripheral and auditory neural functions. Secondly, we are using the autoacoustic emission, or OAE, which is testing the sound that emitted by normal and healthy cochlea. Why we choose the different equipment for the different staging neonatal hearing screening program? It is because all equipment will have their own advantages and limitations. For the OEE itself, the advantages include very fast in getting results, very minimal preparation, very low operating costs, and very sensitive to conductive findings. However, along with that, there are also limitations, which is the equipment may easily be affected by the presence of earwax, middle ear fluids, and debris. It also not sensitive to retrocochlear pathology. In the other way, this equipment may have a lot of higher referral rate. Okay, the advantage of AABR includes it may test the hearing up to the brainstem level with less referral rates. It's reported from a lot of studies as well. The AABR presents with better sensitivity and specificity. But along the way, it also has limitations. First, we might miss the conductive finding. Secondly, the test is slightly time consuming. And number three, the equipment itself is quite expensive. Same goes to the consumable. Okay, next, before we start to perform the screening test to the baby, either in ward or in the clinic itself, we will need to prepare a few things. Firstly, we need quiet environment or quiet room. It means the screening test does not need the soundproof area. What we need to do is actually to control the noise from the environment. Secondly, the baby should be in stable condition without any medical equipment. And last but not least, we prefer the baby is quiet and sleeping steadily. For this, we usually advise parents to feed the baby well before they come for the procedure. The advice also being given to the parents in the postnatal wards before we come for visit and do the screening test with their babies. Okay, after the screening has been completed, the result usually will be shown shortly. Usually the result appear as pass or refer. For pass, that means the neonate's hearing is actually adequate enough for them to develop normal speech and language. However, if the result showing refer, it means the neonates need further evaluations. So, following to that, we will usually schedule an appointment for second screening or diagnostic testing. Okay, this is actually the example of findings from the OAE. As we know, the result will appear as pass and refer. Okay, now these are the results that we will get from our AABR, which is also pass and refer. Okay, as we are doing the universal hearing screening only in postnatal ward at weekdays, there are chances that some of baby might go home without being screened. This is actually the misscreened cases. So, for these cases, the baby will be given appointment following their discharge within 4 to 6 weeks. We are also recommending a regular surveillance and screening in the primary healthcare facility. For babies who do not follow normal developmental milestone or whom there is concern, they should be referred to us for further evaluation. Okay, this is actually a few documentation that we use for the programs. Once the test has been completed, the result will be recorded in the baby's book, the buku rekod kesihatan bayi, usually around page 17, 18 or 19. Next to that is actually the referral form for the neonatal hearing screening program in Hpsf MUA. This referral slip will be given to babies who has been misscreened or the baby who is discharged from NICU. This referral slip is actually meant for newborn. So, for other cases or for other pediatric cases that need audiological evaluation, still need a proper referral letter to be written to us with the proper notification reason for referral. Okay, this is about referring cases for neonatal hearing screening at Hpsf. All babies who are born at Hpsf shall be screened at audiology clinic in Hpsf itself or other hospital with audio facilities around Malaysia. For internal referral, we would require the referral slip only. But for external referral, it is recommended and better still the referral slip to be attached together with the proper referral letter. Okay, this is our take-home message for parents. Usually, we will attach this brochure in the baby's book, the buku rekod kesihatan. Here we have listed the normal developmental milestone as a checklist for parents in regards of their child's hearing status. From this brochure also, parent may find information like the list of hospital that has neonatal hearing screening. Okay, as usual, all program will need to be monitored and evaluated. Same goes to our neonatal hearing screening program. This is to ensure that the quality has been maintained and to find any room for improvement in any area that is needed. Some of the activity that we do includes to enter all the screening data into the hearing screening database every day. Next, as the program coordinator, we will evaluate the program every 6 months based on the quality indicator that has been listed by the national team. Next, our committee member itself will have progress meeting for at least twice a year to have an update for certain situation or issue and discuss the solution. Last but not least, the program performance will be reported to the National Hearing Screening Committee yearly. Okay, now for the benchmark. For this neonatal hearing screening program, we are following the benchmark that has been stated by Joint Committee of Infant Hearing in 2007. The list of benchmark includes to cover the percentage of babies underwent hearing screening should be more than 90%. Secondly, is to cover the percentage of babies who return for follow-up should be more than 70%. Next, the refer rate for follow-up following failure in hearing screening should be less than 4%. And last but not least, we also should cover the percentage of baby who failed hearing screening and completed the audiology evaluation should be more than 90%. Okay, as I mentioned earlier in the presentation, the neonatal hearing screening program is actually includes the neonates come from the high risk category. Okay, here I have listed the risk factor for the hearing loss that has been stated in the Joint Committee of Infant Hearing 2007 position statement. Okay, the lists are, okay, number 1, family history of hearing loss. Number 2 is the in utero infection. 3 is the craniofacial anomalies. 4, baby with birth weight less than 1.5 kg. 5, hyperbilirubinemia, which require exchange transfusion. Number 6 is the ototoxic medication that used during the neonatal period. 7 is the bacterial meningitis. 8, babies with low Apgar score. 9, babies using mechanical ventilation for more than 5 days. 10 is any syndrome that associated with hearing loss. And last is baby who stayed in NICU for more than 2 days. Okay, this is actually the additional list to the first one. This list of risk factor is for infant aged 28 days and onwards until 2 years old. Okay, first in the list is the parental concern regarding hearing and speech developmental delay. Secondly is the bacterial meningitis infection, which might associate with sensory neural hearing loss. Number 3 is the head trauma associated to the consciousness or to the loss of consciousness or skull fracture. Number 4 is the presence of any syndrome that might develop later and has associated with hearing loss. Okay. Number 5 is the usage of ototoxic medication. And last but not least is the presence of persistent otitis media to the baby. Alright, now is the updated information about the neonatal hearing screening program. Based on the position statement by Joint Committee of Infant Hearing in 2019, some babies who come from the high-risk category might require a periodic monitoring of their hearing. The first indicator is actually associated with the delayed onset of sensory neural hearing loss. These include family history, in utero infection, and the neurofibromatosis, as well as neurodegenerative disorder. Next is the indicator that associated with conductive hearing loss. These include the presence or persistent otitis media to the baby. Next is due to the anatomic deformities and other disorders that relate to the middle ear system. And lastly is because of the presence of neurodegenerative disorder. Okay, again, following to the latest JCIH position statement 2019, they have mentioned clearly that some newborn and infant may pass the initial hearing screening, but sometimes they are also required the periodic monitoring. This is actually to detect the delayed onset of hearing loss. They also recommended and strongly recommended baby with the indicator will need to do a complete hearing evaluation at least as early as 3 months after the incidence or by the age of 9 months. And they are also suggesting the monitoring process shall be resumed until the child has reached the age of 3. Okay, this is the neonatal hearing screening flowchart. Starting from the first screening, and next is the second hearing screening stage, followed by the full audiology evaluation, and as well as the monitoring and discharge phase. Okay, for the next slide, I will conclude the finding from our neonatal hearing screening program for the past few years. Okay, in regards of appropriate and timely diagnosis of hearing loss, from the schedule, we will see how the criteria in terms of age is improving over the years. This is actually reflecting overall acceptance about this program, as well as increasing awareness among the medical practitioner and public society. Okay, this second schedule is actually representing our final finding on neonatal hearing screening for the past few years. From the coverage rate, we could see that the figure is inconsistent every year. The main reason that could contribute to this is actually because of equipment breakdown, as well as reducing number for staff. But the numbers of detected hearing loss every year is quite significant. Um, for your information from this program as well, at present we have two patients which is in waiting for cochlear implantation soon, while another two more patient is in a process of evaluation for the cochlear implant candidates. Okay, now we have come to the conclusion. From here, we could conclude that neonatal hearing screening is actually a very important component in the early hearing detection and intervention program. From here as well, we could see that all team of professionals that involved for the hospital neonatal hearing screening program should review the policies, infrastructure, and consider the variety issues in relation to the success of their own hearing screening program. Last but not least, I would strongly agree that neonatal hearing screening is actually a crucial component in support to our national cochlear implant program, as well as other early intervention program in Malaysia. Alright, before I end my presentation, I would like to share with you with these special quotes from Helen Keller. She is actually a special person who are born deaf and blind. She said, blindness might separate people from things, but deafness definitely separates people from other people. I hope you might find the meaning deep into your heart and keep it into your mind. With this, I end my presentation.